Hello, my name is Jheonel Hue, and today I will be talking about water, sanitation, and hygiene, also known as WASH. My objectives are to provide a brief overview of WASH, as well as to provide an overview of WASH's impacts on health in lower middle income countries and vulnerable populations such as women and children. First, I will define what WASH is and review access to WASH globally. I will then discuss the fecal oral cycle of illness due to poor WASH conditions. I will discuss WASH's impact on health, and then discuss diarrhea as a cause of death in children related to poor WASH conditions. I will end with WASH's impacts on women and girls. What is WASH? WASH refers to water, sanitation, and hygiene, and it focuses primarily on the access to and use of safe potable water, sanitation relating to toileting and hygiene practices, such as washing of hands with soap. While water, sanitation, and hygiene are three separate issues, they are grouped together because of their interdependence. We cannot fully realize one without the other. Here we see data gathered by UNICEF and the World Health Organization regarding global access to water and sanitation. Roughly 800 million people lack access to basic water services, and an estimated 2 billion people, more than 25% of the world's population, lacked access to basic sanitation. In 2020, around 1 in 4 people lacked safely managed drinking water in their homes, and nearly half the world's population lacked safely managed sanitation. 8 out of 10 people worldwide who are without basic water services resided in rural areas, and nearly half of them lived in sub-Saharan Africa. The data does show that access to drinking water facilities and access to sanitation facilities increases as the income for the country increases. Sub-Saharan Africa does contain the lowest percentage of safely managed sanitation facilities, as well as the lowest percentage of access to drinking water facilities. Unsafe wash conditions is linked to many diseases and risks, including infections, diarrhea, and non-communicable diseases. Without latrines or toilets, water sources are at risk of becoming contaminated with feces through open defecation. Feces contain different sources of pathogens, which are just waiting to be transmitted to healthy hosts. Germs can be transmitted from feces via improperly washed hands that come into contact with food, hand-to-mouth ingestion of soil, usually by children, or feces contaminating ground surface water. These pathogens cause diarrhea, which affects the nutrient absorption in adults and children. However, chronic exposure in vulnerable populations like children of these pathogens put small children at risk for permanent changes in the gut that would no longer allow for proper nutrient absorption necessary for normal growth. Without proper nutrition, children may develop other issues like stunting and nutrient deficiencies. This graph shows data on trends of how WASH can be linked to mortality. Water, sanitation, and hygiene practices are different around the world. Each portion has an additive effect on disease mortality. This study shows that countries and different cultural practices greatly impact WASH and greatly impact incidence of disease. Untreated water and lack of proper sanitation and hygiene put health, education, and livelihoods at risk. Without sanitation, water sources for drinking and cooking can become contaminated. And without safe water and good hygiene practices, individuals in lower middle income countries are exposed to diseases and infections that can be life-threatening. As we see in Figure 4, diarrhea also affects vulnerable populations like children at a disproportionate rate. Children were more likely to be killed by diarrhea than of malaria, measles, and AIDS combined. According to the CDC, diarrheal diseases account for 1 in 9 children deaths worldwide, making diarrhea the second leading cause of death in children under 5. About 88% of diarrhea associated deaths can be attributed to unsafe water, inadequate sanitation, and insufficient hygiene. Refugees and women spend many hours daily traveling long distances or queuing at hand pumps or tap stands to collect water. Often, this responsibility falls on girls and women. Globally, girls and women around the world spend 200 million hours a day gathering water, impacting their time for school and their time for jobs around and inside the house. In 8 out of 10 homes without running water, women and girls are largely responsible for gathering water each day. In this study by Graham et al., looking at households lacking access to water, adult females were predominantly responsible for water collection. They were also found in regions that children were responsible for collecting water primarily. Female children dominated water collection. Sanitation ensures girls' safety and privacy, allowing them to avoid dangerous situations that may put them at risk of injury in transportation of the water and gender-based assaults. Sanitation initiatives support menstrual hygiene management by allowing girls to not have to skip school each month or dedicate their days in walking to get water. Female teachers also benefit from accessible sanitation services in the same way that young girls do. All this information proves that access to water, sanitation, and hygiene will improve the livelihoods of these women and children. To summarize, water, sanitation, and hygiene work together to keep communities healthier and more resilient. Without wash, preventable illnesses such as diarrhea make adults and children sick and prevent children from absorbing key nutrients and making them more susceptible to health issues.